audio.
Yeah, I've never done a video, I don't think, interview before.
Yeah,
so
it's pretty exciting stuff, man. Yeah. So, what we got? Coffee Press.
Coffee Press episode 10.
Is this episode 10?
It's episode 10.
I've lost count.
We're at that point right now. We're losing count of our episodes.
Well, we're also at that point in the day where we're not drinking coffee, we're drinking beer, right? So, I don't know, that's where we're at. But yeah, Coffee Press. So, I'm Tyler.
I'm Patrick.
It's Patrick, and
We have a special guest.
we got a guest today. It's Dr. Brandon Lowe. So, some of you may know him, some of you may not. But either way, Dr. Lowe is an orthopedic surgeon, and he's hanging out with us today. So he's got a lot of knowledge when it comes to everything in regards to orthopedics, right? So as you may know, I'm an exercise physiologist and a strength coach, right? So I work with athletes on the daily, right? So Patrick is a physical therapist. Pat works with people rehabbing injuries, right? I work on the performance side of things. So with this little realm we call sports medicine, right? It's not just one person. It's an entire team, right? And so oftentimes for me, I feel like people don't associate an orthopedic surgeon in that team, right? They just see the surgeon as somebody who's going to cut on you, and then that's it. And then they're done, right? Then they go to you or me or whatever, But Dr. Lowe, how would your role? How would you define your role as an orthopedic surgeon in the world of sports medicine, and then also too with like general population?
I think, we're definitely part of that team, sometimes more involved than others, I guess first of all, thank you guys for having me on your program.
Yeah, man, this is awesome. Thank you so much for being out here.
But yeah, I think, orthopedists, sometimes we're only involved at the last minute when it's a big bad problem, and you guys have been working with somebody for a long period of time, or, a patient or an athlete or a student athlete, and then we only get involved when things aren't getting better, or other times when you guys are involved in the day-to-day strength and conditioning and doing, all the things that y'all do, and we're involved when there's a big, catastrophic injury or something like that. But then there's a lot of times also where we're involved kind of at the same level that you guys are, especially with, as you get up the sort of chain to more high-level athletes, when you're sort of hyper-vigilant of small problems and trying to get things under control before they become big problems. And probably for us, especially for me, but I think most orthopedists that deal with athletes, good relationship with you guys is key, because we can talk about patients and come up with treatment plans and get the therapy piece involved, and so I think clearly it's a better system when we're all working together.
Right. Well, and that helps with that athlete-centered approach too. Regardless of what level they're on, when they've got a team taking care of them, they feel like they're like, wow, these guys are truly care about the outcome. They don't want to just do some random cookie cutter exercises or some procedure and then kick you to the curb. Like, we actually care, and as a team collectively, our goal is that person, right? That individual or that athlete, however they're defined. So sports medicine, though, that's like I said, it's such a broad realm of things, though, right? So
you hear a big term, because somebody out here would be an athletic trainer,
right? Exactly.
Schools or for sports teams, and they have advanced degrees. They work in the field as well. Even the coaches have got their role. The strength
exactly.
coach,
the sport coach
well,
too.
The sporting aspect as far as truly going to have not prevention, but as far as have a good strength program, so minimize risk of injuries. But there's always going to be risk of injuries when you have like a whether it's contact or non-contact sport. It's almost a matter of not if but when in some cases.
Exactly.
So,
yeah. The minute you do something,
that management. So
exactly. Yeah. Well, the minute you do something active, or like with COVID, you got people who started riding their bike more, right?
Yeah,
And they haven't ridden their bike in years, and now they're riding their bike and they're developing some type of condition in the knee, or something, and then they try to self-diagnose through Google, because you can Google anything, right?
Dr. Google.
Dr. Google, right? So they try to self-diagnose, and so that would be where that team comes in, and then they come to you, and then you say, well, you don't need surgery, because maybe that's what they're thinking. You Google and you see the worst possible scenario, right?
Yeah.
And I'm not saying surgery is never needed. Sometimes surgery can be needed, and you can talk a little more on that if you'd like. So actually that brings me to a question, when would surgery be required, right?
The vast majority of athletic injuries, that's the last resort, is an operation. And thankfully, especially in the younger, more athletic populations, there's a lot of physical therapy, rest, anti-inflammatories, and time, stretching. There's a lot of steps before you get to an operation. Outside of fractures or traumatic ACL injuries and stuff like that, but the average overuse syndrome or tendonitis, or a lot of that is just kind of reassuring people that it will get better without an operation, and then usually kind of working in concert with you guys to come up with a plan to get it better. And in the athletic population, a lot of times it's probably the best place that I see you guys doing a lot of good work is getting people better without us having to shut them down completely.
Right.
Because a lot of times, you can get rid of most problems if we put them in a cast and tell them not to walk on it for 6 weeks, or brace them, or something really aggressive as far as rest. But then they come out of that whatever immobilization they were in 6 weeks later, and they've got muscle atrophy and the coordination's off, and now we're 3 months behind as far as athleticism is concerned. And so we haven't done them any favors. We're happy because it didn't hurt, but then they're just way behind, and especially in athletic populations, they don't like that. So having y'all be able to maintain strength, maintain mobility, but still offload certain muscle groups and re-educate, give them some tips. And so I think that's where it helps a lot. It's just us being in communication and working people through those things.
Definitely, yeah.
That brings up an interesting thing, because we were both in the military. You had a high performance job in the military and special forces. Then with the athletes, just like that, there's certain situations where some people have I'm going to go to break mentality. It's well, whether it's PT or management, it's I'm going to go until it breaks, because I know the culture. I know as a physical therapist is, even whether it's return to sport after surgery or just somebody who had a non-contact injury, a lot of athletes, coaches, a culture in sports, mixed martial arts, and and military, law enforcement, people whose livelihood is high performance.
Your tactical type athletes, right? All those guys,
That's something we could talk about too. Is that culture of just, they're going to go to a breaks. They're going to go until that knee gives out.
Right.
They're screaming. You're a paramedic also, and they're being taken off the field, and okay, that guy's done.
Right.
Because the culture is I think there was a receiver for the Bills who fractured his fibula. It's a non-weight bearing bone in your leg. He's an NFL player, and he just took pain meds and played professional football with a broken bone in his leg. Mind you, it's a non-weight bearing leg, but imagine he's taking pain meds to play professional football.
Right. Well, it's still a fracture, man.
Yeah, but it's it's non-weight bearing, and it's that's a different type of culture. It's more on the medicine side, and the culture of that's I'd be uncomfortable working with the guy, but it is you have multiple millions of dollars on the line. Multi-billion dollar industry. So it's that culture when lives are on the line, multi-billion dollar industry.
Yeah.
It's how do you tell someone well, if you go back to play, you might regret this for the rest of your life. But it's this is my lifetime goal, so I have no other choice.
Right.
And so y'all wouldn't mind talking about that, because you have a lot of experience in it. And,
Sure. No, a lot of what we do, in athletes is, diagnose what's wrong, that sort of thing. But a lot of it is, if I play with this, am I going to do long-term damage? Is it going to be sore? Because most people are, I have that conversation a lot, especially in the pediatric athlete population with the parents, and well, can she play Saturday? Is it your equivalent of the Super Bowl? Then
you're like today's Saturday, it's not going to happen.
And sometimes it is, it's a painful condition, but it's not dangerous.
Right.
You can tape it up and you can play, but other times it's just, no, you just can't.
Using good judgment, that's the main thing. But when we start talking about the pediatric population, the adolescent athletes or whatever, you'll have a lot of parents who want to intervene, and they, as a parent, like you and I both are parents, so we feel like we know what's best for our children, right? But if there's something going on, it's like I want to include others who are not going to look at it from a biased point of view, right? Because sometimes a parent push and say, "Oh, you're good, walk it off," It's like, well, you just tore your ACL. You don't need to just walk it off.
But it's like, well, I went through this, or genetically, our family has a high threshold of pain. We heal faster.
Right.
Like, there's all these, like, okay, understood, but it's
right. Well,
it's hard to argue against that. That's
exactly,
that's the
yeah.
child,
Well, we've talked about the pain threshold before, and pain tolerance, right? And, I have a high pain tolerance. Pain is subjective, right, for the most part, right? And you got somebody talking about that fractured fib. It's like some random person would be in agony. You know what I mean? Like an average person.
Yeah.
Or even a kid. So that's something that needs to be addressed. Hey, just because he did it doesn't mean that you should do
It's
it.
an anecdotal case, like, well, this random person did this, so it's
Right.
like, well, you got to be respectful about it. As bizarre as it sounds, and that's also hard too, because you got to be in whatever environment that we practice in. You have to maintain that professional demeanor of like, this is the most bizarre conversation ever, but I have to stay professional and just.
Right.
Because this is their kid, and like at any given moment, this can go the wrong way.
Oh yeah.
And I lose them, and like whatever point I'm trying to make is not going to be made.
Right.
And in sports too, I mean, we're sort of all to blame for that culture because we glorify it, I mean, he played with a broken whatever.
Yeah,
or,
exactly.
He had 16 tackles and he had 3 broken ribs, and everybody, sort of makes that something to, look up towards.
Right.
So that's part of the problem. I think.
Yeah, it puts you on that pedestal. It's like, oh, he's a bad word. He's awesome, he did that. Oh man, yeah, and they're giving him praise, right?
Yeah.
What's he gonna do when it happens again? He's gonna do it again.
Yeah.
But it's that warrior culture. It's like
Right.
that gladiatorial warrior thing. It's like, hey man, we'll help you. We'll pay for your rehab. Like,
Exactly.
especially these big boosters, they're gonna pay for everything. And then hey, every time you come to a tailgate, we have brisket for you, man.
Yeah.
You can tailgate with us every day. Now you're legendary. So honestly, we got to talk about it realistically.
Right.
Like, if people's goals are to be legendary, our job is to be the best professionals we can do and do our best decision. And just when they come back, better or worse, just go from there. And that's the hard part too. Is like, okay, option B has occurred. What do we do now? Oh, option C now. You go down the line.
Well, we're going all the way down the alphabet now.
I think that's the challenging part. I started realizing with experience as a physical therapist. I think it goes the same along with other professionals in sports medicine. It's just like it's never going to go according to the textbook.
Mm-hmm.
And like,
no
you
way.
don't have to know the textbook because you have to know it backwards and forwards. Because in the real world, it's going to come at different entry points.
Exactly.
Clinical setting, the field. In the grocery store, somebody's tapping you on the shoulder, or like you guys are medicine to get emergency medical responder. You're a paramedic. What if somebody like just breaks their leg in a parking lot? Okay, you try to go in and triage them. So whatever entry point it is, it's like, man, this is just a different way we're going to get these different people.
Right.
And any good experience we can give them can be just very life altering. We also know that there's limiting factors in it.
Right.
We're not going to listen to everything we say. And you gotta be not be okay with that. And that's why I learned to just appreciate what I can do and let myself there refer out or just wish me best of luck. That's the biggest thing I've learned. It's not to always have an answer. Like I give you my best answer. I think you should talk to your physician, your surgeon. Okay, I think you should go talk to your coach.
Right.
And that's so hard because before you want all the answers, you're gonna be like, well, we can do this with physical therapy. It's like, well, not. Let's go talk to someone else.
Not exactly.
Let's go talk to someone else.
You need more. You need more than this. Well, that brings me to a good point. Like with the athletic population. They're a different breed, man.
Yeah.
If they're a true athlete, we were kind of talking about this beforehand, with the winning culture and all this stuff, when you got a true athlete, not just somebody who's going through the motions, right? But a true athlete who actually wants to be out there and grinding, right? And with for whatever reason they have something happen where that gets taken away from them. You put them in a boot for, X amount of weeks. How compliant are they going to be, right? And then it goes back to the parents. The parent will be like, I think you're good. Well, Dr. Lowe said I need to wear it for X amount of weeks, and it's like, what does he know? You know, well, he knows a lot, man. You know.
Exactly. That's actually a constant reinforcement, like we call it the post-surgical or
right.
pre-injury protocol. It's like, well, this is tissue healing.
Yeah.
I know your Uncle Billy. I know this receiver for the Bills healed faster. They had experience, but I call it the professional answer. This is all I can tell you. You just need to really do that.
Exactly.
But I always tell them this now lately is, but if you do break the rules, please tell me. Because it's kind of like being it's almost a parent role. You have to be strict. You can't let your kids drink or do whatever underage. But you need to talk to me if something happens, please.
Right.
Because if you don't, they're going to lie to you. And you have experience, you can tell someone's lying.
Oh yeah, man. Once you shut that door, man, it's shut, man.
And
yeah.
Even as a therapist, I know the physicians, and you guys can probably say it too. Like, if somebody has a sling on, they're not supposed to move their shoulder for X amount of weeks, then they're all stiff and painful. They're like,
right.
this. I'm like, what have you been doing? I cooked some eggs this morning.
Right.
How many eggs? 100.
100. Yeah.
Let's take care of this and just keep it moving. But I started realizing, because if I shut them down, I'm like, this is wrong. My first year or two out, you're in trouble. And all of a sudden, they don't tell you anything. And the majority of my patients were breaking the rules, but I had to get it out of them. But I mean, long term, just have an open professional stance, but being ready to accept, okay, what did you do? Plan B.
Yeah.
That's been that's taken a lot of stress out of my life. So not having to deal with that, 'cause it's not on me, it's on them. But I have to try my best to be a welcoming personality, be professional.
Yeah.
It's on them after that.
Exactly,
That's
man.
the hard part about that I had to learn outside of school.
That's the stuff that's not in a textbook, right?
Case by case. That Dr. Phil stuff, that bedside manner. So.
Right, man. Yeah, for real. Well, one thing that I've seen is that, kind of going back to, whether it's a surgical procedure that they had to have, or, whether it's something arm in a sling or whatever, you can still do stuff. And that's one thing that I see a lot. It's like, just because you're not able to do something on the right lower extremity, we can still do left lower extremity. We can still do upper extremity. We can still do core work. You can continue to progress.
Yep.
That way, when you get back, you're good to go. You're going to be better than what you would be if you just sat and did nothing. Right.
And I thought this big thing too with kids, especially teenagers, even adults of all ages, is just like those modifications are really needed, because outside the medical clinical world, sometimes they're at home and it's like, I don't know if it's clinical depression, but they just get down.
Right.
They lose motivation, and you can't just say, well, they're not compliant. Well, this is beyond non-compliant. These are adults.
Yeah.
And like, what's the underlying issue? Why aren't they following the rules? Why aren't they doing this? And keeping them motivated. And that's really important as a physical therapist. I know you guys as physicians, and in the sports medicine and strength conditioning world, you actually know your personalities.
Yeah.
You can't come at them too much or too little. That's the hard part too. Once again, that's what you learn in the real world experience.
Right.
Is like, how do you communicate? Let's stay active. Let's respect your needs. Let's not break the rules. Let's try this.
Right.
And that actually helps the recovery process of the injury.
Right.
And that's something that a lot of people, when they get injured, don't think about. It's
Yeah,
like
you're
staying
absolutely
motivated,
right.
staying
Yeah.
happy, and try to be a balanced person and get through this.
Well, going back to kind of that team approach to things, one thing that I appreciate Dr. Lowe for is that, I actually know how you work with patients, and I know that you do invest in your patients, and you give them time to talk, and you listen, and you talk back to them, right? And not talk back, but you communicate with them,
Sure.
right? And there's that network there, man, and that right there, that goes so far when it comes to either an athlete or general population. Again, when you give somebody the time of day, they appreciate that, man. They're like, wow, it's that whole thing. No one cares how much you know until they know how much you care,
Yeah.
right? Like that's real, man. From all three. We got a triangle set up here, and this is exactly the way it is, man.
Yeah.
Performance, rehab, and then the physician side of things,
I think the communication part's really good too. I mean, just knowing that, like, if I see somebody in the office and I see that they came from you, and then I'm going to send them to you, and all the three of us are communicating.
Yeah.
I don't just say, "Oh, how's therapy?" I can
Right.
say, "Oh, what'd Pat tell you? Last time I saw him, he said you were making good progress, and
Yeah.
you've been working with Tyler lately." And I mean,
Yeah.
people really like that.
They do,
I
man.
think it really contributes to better outcomes. Just knowing, not only the science of our communication together, but just the feeling that it gives the patient that we're really working hard to make them better.
Right.
Yeah.
And that's more of in the coaching world, the strength coach world, we call that the art,
Mhm.
right? That's the art right there, Because I don't care if you can do a procedure or, you know, you can rehab with the best of them or whatever. Or if, you know, in the performance world, if you're doing the next best exercise, you know, the sexy movements or whatever, you know. But, you know, if there's just like no art there, it's what is it, you know? If there's no connection, what is it, you know? Yeah, this is good stuff, man.
Yeah, man. Yeah. So those are the extra stuff we're talking about, that art, that stuff we learn outside the classroom, we put it all together. Because that's what I started realizing was the hardest thing. You can tell anybody do an exercise or listen to this, don't do that. But it's like, how does that compute in the human brain?
Right.
What's there? What are they going through? If they're going through that 1 second, a form of depression, or it'd be like, you know, some people on workers' comp. They don't want to play sports anymore, because I see that a lot with teenage kids.
Right.
They don't play sports anymore, and they're actually just in PT, not motivated, not doing anything, but they're just trying to indirectly tell their parents that they're done with sports.
Right, they're trying to find a way out.
Yeah, so that's a weird way of communicating. It's like, what are the real goals? And then how do you go to the parent and be like, I don't think your kid wants to play year-long baseball anymore.
What do you know? Who are you to tell me that?
I did this, and this.
Right,
My kid,
right.
the kid's in the corner like shaking, and
Yeah.
it's like, oh man, it's like, all right.
Yeah,
We'll
I
try
played
our
college ball. I did this and that. You know,
How do you think
my
you can
kid's
do that?
gonna do it too. You know.
And that's a tough thing too, man. So whether it's whatever spectrum and just see
Right.
where somebody's at and meeting them there, I think that's something that we're missing a lot too, besides from the science. Or that's a hard part to pick up on by some professionals. But
Yeah.
that's always a big challenge in any case. So.
Yeah.
And anything you wanted to add, Doc? Any extra?
No, I think that's it.
Yeah.
No, I don't know. I think it's nice when we all work together.
Yeah.
Definitely.
That's the main thing, man. You know, and Pat and I, we've talked about that before. You know, just how there's disconnect in certain tiers where there doesn't have to be, or there shouldn't be disconnect.
Mm-hmm.
We talked about it last week with the academia and the practitioner side of
Exactly, yeah.
things, right? And there's always, I feel like there's always going to be disconnect, but you know, the more advocates there are in every discipline, right? Kind of bringing it together and bridging that gap,
Yeah.
the greater success we can have and the greater outcome. You know,
Yeah.
you said that earlier. I like that word, the outcome, right? The greater outcome for the patient, the client, athlete, whatever you want to call them, right? Person. They're an individual. They're a human being, you know. So the greater outcome for that individual,
And
man.
I think
That's awesome.
that's a big term we hear a lot in different settings, is the client or patient-centered approach.
Right.
Because it is, aside from, like, most hospital systems have like a press ganey or customer service, and that has its own thing, but there's something to that. It's like, because we're here to deliver healthcare, a product, and the best thing is you don't want to feed into it, enable bad behavior, or give the patient or client what they want, but you truly want to do what's best for them
Right.
professionally, and I think that's a patient-centered approach right there. Like I said, that way, you know, whether it's whatever setting you're in the sports medicine continuum among us and others out there, that people are getting the best care for them, and
Yeah.
I think that's the best thing we can do in our unique roles.
Well, talking about the surveys real quick.
Right.
Most of the time, people only fill out a survey when they had a horrible experience.
Exactly. Yeah.
That's the only time they're so pissed off. That's when they're going to jump online and they're going to break their keyboard typing something.
It's about
you know?
parking, the door.
Right,
We have
whatever,
that
man.
door that we put millions of signs on it, push the handicap button, and we have people that hurt their shoulders trying to open the door.
Always
and we keep
something to
telling
say
them.
about the door, man.
So we're
You know?
going to talk about the door. We're having an entire episode on the door.
Right.
That's going to be a 20-minute episode. But the thing is,
Oh,
it's
man.
just, like I said, I think that's a good thing we can see, is that customer service approach. But the bad thing is, customer service approach sometimes at hospitals is just pain relief.
Right.
Or like satisfaction. And sometimes people may be in pain and not be satisfied to their expectations, but they still have the outcome.
Right.
And I think that's a challenging thing we can still have, regardless
Yeah.
of how good of a job we all do.
Definitely, man. Yeah.
But man,
That's awesome.
It's good having you guys here. I mean, oh no, you invited us here. This
Hey.
is the first time. This is the first time we shot in here.
My place,
Or
man.
second time we shot here.
We filmed a few little snippets here and there, man, but we've
Okay.
never actually done. Well, we've done an episode on my front porch. You and I
Okay.
did, yeah.
That's
Yeah.
right.
But now we're in the Morrison Garage Gym.
It's official. Another location. It's like a traveling situation. We have like
Right.
4 or 5 locations that we've seen us film at, aside some coffee shops.
Yeah.
So now the last time was coffee. Today's the press
Right.
of the coffee press.
Exactly. Yeah.
Yeah. So thanks, Dr. Brandon Lowe.
Yeah. Thanks,
Um,
Dr. Lowe. Thanks for coming out, man. We appreciate you.
No, thanks for having me. I appreciate it.
It's awesome. Right on.
I'll be on the
Coffee
bench
Pros.
if y'all need me.
For real. All right. Coffee press. Peace.
Awesome.